Good evening, everyone, and Om Shanti, and a very warm welcome to this program, No Cancer Better. It's a 10 days cancer awareness campaign by Center for Indian Studies Kuwait and Indian Doctors Forum Kuwait. I'm Pavitra. I'm from Harmony House, and I'm a meditation teacher and a coordinator at Harmony House. And so on behalf of Harmony House Meditation Center and Center for India Studies Kuwait and Indian Doctors Forum Kuwait, I would like to thank everyone who has joined today and gracing this occasion. And amidst us, we have specialized doctors and spiritual personalities. So I would like to extend cordial welcome to Dr. C.N. Mohanan Nair, Senior Consultant Oncologist. Let me spotlight you, Doctor, so that everybody knows. Yes. So Senior Consultant Oncologist, Kochi, India. And Dr. Nair will be sharing his knowledge about general awareness about cancer. And we have special doctor, Dr. Chitradhara. Can we see Dr. Chitradhara? She has not opened the video. Yes, she's there. So, yes, she's there. So, special welcome, doctor. She's Director of Institute of Gynecology and Breast Sciences, BPS Lakeshore Hospital, Kochi, India. And we have another very special guest, Mona Alarfaj. So let me show her beautiful face also. She's there. She's Mona Alarfaj, Vice Chairman of Alarfaj Holding Company and co-founder of Harmony House Meditation Center, Kuwait. A very warm welcome, Mona ji. And we have another very special guest, Dr. Surendra Nayak. Let me spotlight you also, brother. Is there? Yes, we extend a cordial welcome to Dr. Surendra. He is representing Center for India Studies and currently serves as an advisor. So, and also I would like to, of course, thank you and welcome all the participants, those who have joined us today. And thanks again for joining in. So we will start today now with our spiritual address, presidential address from Mona ji. So Mona, let me, I don't know how to spotlight only you. Okay, here, let me try. This is the world of,
Technology.
Yeah, technology. So we are slowly learning. Mona, where are you? Okay, here.
Okay, Pavitra.
Yes, here. Okay. So Mona ji will be here with us now. And Mona, please share with us about Harmony House and about your journey of spirituality and your thoughts about today's, this topic, very special topic. And it's really charitable act that this topic is taken by this Center for India Studies and Doctors Forum. So please share your views. Over to you, Mona.
Thank you, Pavitra. And thanks, everyone, my brothers and sisters, joining, I think, from the whole globe. And thanks again to the Center for India Study in Kuwait and the Indian Doctors Forum, the Indian Embassy. I think it's great that you are initiating programs of the awareness in Kuwait. And we're very happy to be part of it today. Of course, as Pavitra shared, I have a job, but I started actually practicing meditation 12 years ago, practicing, let's say, every day. And I've seen a big difference, a big impact on my life. And that's where I became a co-founder in Harmony House. So Today, actually, I want to share a few thoughts about Harmony House, and then we'll go on the topic of the power of meditation and the power of thoughts on the body. And Harmony House is actually a meditation center that's been operating in Kuwait for the last 17 years. It's offering classes and seminars and workshops in different topics related to well being, starting from meditation, self discovery, positive thinking, um, stress management, and many, many others. So we have teachers in Kuwait that speaks English, Arabic, and Hindi, and we also, from time to time, host speakers from abroad, from different backgrounds, where they have shared their knowledge of meditation and their own journeys. And so the center actually was operating until the corona happened. And so we were having students coming in. At the moment, we are running our programs through Zoom. So whoever is interested to be on our database, please leave your phone number or email, and then Pavitra G will get in touch with you. And so we are talking today about a very, let's say, special topic, which is the awareness of the cancer. But what I will share today is some aspects, as we know, for the well being, or let's say for the human being to be balanced. There are four areas that needs to be, let's say, monitored, which is the physical, the social, the spiritual, and the mental. And so I will take the angle today, and then I will share a few thoughts about my own experience. But since I think doctors are joining us today, I just want to mention that there is a very important doctor. His name is Herbert Benson, who is a professor at Harvard University. He has written many books about the impact of meditation on the physical body and how meditation can heal the body. His latest book actually is called Relaxation Revolution. And in that, he's mentioning that 4 minutes practice of meditation for 6 weeks, patients have seen benefit on their health. He also actually showed some statistics on the different kinds of patients, including, of course, cancer patients. And in that book, also, he mentioned that a practice of 15 minutes meditation for 3 years, they have noticed that there is thickness of the brain. There is an increase of the thickness of the brain. And those who have practiced actually more than 10 years, their genetic expressions has changed. So he published his results with the genetic department at the Harvard University. And whoever is interested at the end, we can also share his book and his name. So meditation actually is helpful for every human being, and meditation actually comes from the word medera, which is a Latin word that means to heal. And of course, now medicine has so much been developed that it can heal the symptoms. But what we are talking here now is actually the prevention of the sicknesses before they appear. And so, what we do in meditation is actually getting in touch with our real self, we call it, which is the energy within the self. We can say there is the conscious and the unconscious. So, in meditation, and maybe in Harmony House especially, we practice Raj Yoga meditation. And maybe those from Indian background know the meaning of Raja, which means the king. And so we are coming back to our mastery of the self. And that happens in a very subtle process, which starts from observing our mind. And there is a very nice sentence that I've heard that I've read for our Professor Einstein, our scientist. And in that, he mentioned that if we want to solve any problem, then we can't solve it from the same consciousness that created that problem, which means if I want to solve any problem, I need to go to a higher consciousness and then be able to solve that problem. And so, meditation, in essence, is actually becoming aware of the real self, of the inner self. And I think we know now so much about the world outside, but we still know very little about our self, our inner self. And it's like we came to this world with the mind, but no one really gave us the manual of how to deal with our mind. And there are many books now that are written that says for every pattern of thoughts, there are different sicknesses in the body. So the feeling is that really every pain that comes to us, every sickness, the seed of it is the way we think. And I feel like personally, the pain comes as a message for us to change something. And I can speak from my own maybe experience that a few years ago, I used to have a lot of dizziness and neck problem, and I've seen so many doctors. And then at some point, I thought, okay, I'm gonna just accept it and let's see how things will go. So the minute I accepted that disease and I didn't really resist it, I realized that after doing certain techniques, of course, seeing also some doctors that helped me to give me some exercises, but I noticed a very simple technique, which was sleeping more, because um, like I work long hours and I always thought that 5 hours were enough for me. But then when I traveled at some point and I was sleeping more, I just realized that that pain has been reduced. And so, really, when we give our body that relaxation and when the mind is revived and rejuvenated, we can feel the impact of that on our body. And so I want to share with you today a few tips about meditation. And I think, Pavitra, we will be having meditation, I think,
Yes,
at the end.
exactly. Yes.
Yes. Sorry, is my sound okay? I've
Yes,
been.
yes, it's okay. It's good. Yeah.
Yes, yes, okay. And so towards the end of the session, we will journey, as we say, in an inner discovery. And so, like anything else, we say that Mother Earth really helps the body to heal. And the same thing actually with the mind. Maybe we can take now just 2 minutes where I can share a few thoughts, and I'll just invite you to have a glimpse of what meditation is. So if you're sitting comfortably, you just take a deep breath and relax. And we just become aware of our thoughts. That's the first step, actually, in meditation. There's so much going on in the mind, maybe some thoughts from what we heard or some things that happened during the day. But when we take even just 2 minutes, we can become observers for our mind. And it's exactly like the example of the sky and the clouds. So I am this sky that is stable, observing the mind, the thoughts. So the clouds come and go. And it's the same with our thoughts. Our thoughts come and go. So anything in life appears and disappears in front of me: the self, the master, the king. We feel like there's a space between me and my thoughts. That's why we say human being. So the human is the body, and then the being is we call it soul, spirit, this inner consciousness. And this consciousness is naturally peaceful, loving, happy, secured. It's just that when our thoughts are racing, that we start feeling different sensations and feelings. But as soon as I become an observer, I understand that I am the master and I can choose my thoughts. That's why it's mastery, self mastery. And with this awareness, I'm aware of my body. And I can send my body positive vibrations. And I start feeling the peace in my body as well. So life is really like a gift. And it's up to me how I live it. I accept every scene and I enjoy every scene. So this is just an example of how we can meditate and how we can give time for the self. It's very important actually as we eat, as we exercise, to keep actually being aware of what my mind is thinking, because as you all know, like the cancer cells, how they multiply, it's the same with our thoughts. If we keep our mind busy in waste thoughts, thoughts of worry, thoughts of anxiety, then one thought can actually create many, many other waste thoughts. Let's say, for example, if I don't like my job, then I would start actually in that process. Okay, I don't like my job, but why I don't like my job? Is it my boss? Is it my colleagues? Is it that type of work I'm working? Um, if I'm not clear actually why I want to leave this job, then I will be running from one job to another, because with meditation, I learned that I have all the power to maneuver my life. And we learn actually all these powers that are within the self. It's just that we need to activate them. And so in Raj Yoga, we actually become aware of what we are thinking and then changing our pattern of thoughts. It's like I just change my perspective. Of course, I can't, let's say I'm not happy with a member of the family. I cannot change maybe the members of the family, but I can change the way I looked at them. And so it's, in essence, it's just, I don't want to take time, but in essence, it's actually changing. Meditation is changing the perspective from the limited to the unlimited. So we start to see things in the right perspective. And of course, as I start to meditate, I'll have more clarity in the mind. I'll be able to take better decisions. And of course, then the impact of that on the body. And so, thank you very much again for allowing us to share. I had many other thoughts to share about the tips, but maybe we can create another time. And you are all invited to Harmony House. And also, I just want to mention that we offer these classes and seminars actually free of charge for the community and for whoever want to join. Um Really, it's just like a treasure that we found, and we like to spread it with everyone. So please do join us and welcome, and just come, just even for silence. We do some meditation classes as well, just silent meditations, because silence is the key. Thank you, Pavitra. I'm sorry if I took more time.
No, Mona, not at all. Thanks a lot for your beautiful lecture. And actually, you drawn the attention towards the most important topic, mind, because it all starts from the mind. That is what we have seen in the world. Like there's always a background music going on here, and that decides everything. So now I would invite Dr. Surendraji. Dr. Surendraji, please, your video. Surendra Nayak ji. Yes. So Dr. Surendra Nayak ji is a very well-known personality in Indian community. He was the ex-president of Indian Doctors Forum, currently serves as advisor of Center of India Studies Kuwait. So please, over to you, Dr. Surendra ji. Can't hear. Okay, one second, one second. Let me. Yeah, one second, one second. Yeah, now please try. You
Yeah.
can now. Yes.
Thank you. Good evening, Harmony House, for organizing today's event. Muna Alparajji, then Pavitraji, and our today's speakers, Dr. Mohanan and Dr. Chitratara. I am Dr. Surendra Naik. I am the immediate past president of Indian Doctors Forum Kuwait. Currently, along with the IDF, I am also working as advisor for the Center for India Studies. Center for India Studies has come up with a noble idea of organizing this cancer awareness campaign for 10 days. And with the help of Indian Doctors Forum and doctors from India also, the campaign is going on with the overwhelming response from the community. This is what we expected, and with the grace of the God, the things are going very nicely. We are very happy to be associated with the Harmony House. I will read a small message from the Center for Indian Studies. Center for India Studies, Kuwait is a collective force of professionals from the Indian community grouped together with the motto, brainstorm and ignite the thought process of our community that will bring overall peace and harmony. Center for India Studies has always looked forward for creative events that aim to make positive changes in the community. We are organizing today's expert talk titled Know the Cancer Better in association with Indian Doctors Forum, Kuwait Medical Association. This is part of the mass cancer awareness campaign scheduled over the 10 days, today being the 11th day, reaching out to all sections of the society. We are extremely delighted in partnering with your esteemed organization, Harmony House, for successfully conducting today's program. We thank Dr. Mohanan and Dr. Chitratara from the bottom of our heart for today's expert talk. I know it's a little late in India, still you are with us. We are so grateful to you, sir, both the doctors. We are very delighted to and looking forward to hear to you, sir. Creating awareness and building a healthy community is an essential process that we have to undertake at this time when the world is facing many health and environmental issues. True to our objectives, Center for India Studies is conducting this cancer awareness campaign, which will be held over the 10 days, along with more than 24 social organizations' participation. We are glad to inform that we have received an overwhelming response. This cancer awareness campaign is being organized as part of our social commitment and responsibility. We believe it is our responsibility more than an obligation to work amongst the community to make a positive change and fulfilling whatever the community needs. We appreciate your effort for conducting today's program efficiently and express our hope that you would continue to stand with us in all our future activities for the benefit of the society at large. We started with the meditation. It gives us so much cool mind to hear and absorb. Thank you, Harmony House, for this very good beginning with the meditation of mind. This is what it's required this time. Thank you very much. Without wasting much time, I straight away thank you. Invite the doctors.
Thank you, Dr. Surendraji. And of course, it's not a waste of time listening to you, of course, never. But yes, you're right that when we start something with that cool mind and calm mind, it really sets things very, very okay. So it's really an honor to be surrounded by so many special people on this occasion today. And as they say that the fragrance of flowers spreads only in the direction of wind, but the goodness of a person spreads in all direction. And we have spiritual personalities today, and we have our doctor today, doctors who are, now I would request Dr. C.N. Mohanan Nair ji to share with us his fragrance, his knowledge, and I just want to let me spotlight you, doctor, so that everybody can see you. Please, 1 second. Yeah. 1 second. Yes, now. So Dr. C.N. Mohanan Nair, he's an MBBS from Trivandrum, MD, Oncology from AIMS, New Delhi. And so many things are there, which if I will read about him, it will take the whole night. But still, few things I would like to read so that our audience know about you better. So training in PAIN, pain, I don't know which kind of pain is this, and palliative medicine, AIMS, RCC Trivandrum, and Associate Professor Oncology, Tehran University, Iran, and HOD, Head of Department of Oncology, Tabriz University, and currently our doctor is Senior Consultant Oncologist, Ernakulam Medical Center, Krishna Hospital, Cochin Hospital, Port Trust Hospital, and there's a list of many, many hospitals here and many awards. He has won many awards. WHO Prize for article on tobacco and cancer. Best outgoing student in AIMS. It's very interesting. Tabriz University Award for the best teacher. Art of Living Award by Pujar Ravi Shankarji in July 2017. And there is again a list of awards. And community work, cancer awareness talk over last 20 years, cancer detection camps, many, many media presentations and various publications about cancer, introduction to cancer, handbook of cancer, and early diagnosis of cancer. So, uh, so many things about you, Dr. Saab. So it's over to you. Please make us aware, general awareness about, about cancer. We are all like looking forward to listen to your talk. Over to you, doctor.
Thank you, Pavitraji. A warm good evening to all of you. Listening to Munaji was a real experience. The realization that most of the problems can be solved through tuning our mind by meditation. I think we should incorporate meditation in the treatment too, because that will tune our immune system. And when there is an alignment between body and mind, the immune cells and the genes will perform better, and we can keep away from most of the ailments. So that is a realization for me. Thank you, Minaji, for that wonderful talk. And also, I would like to congratulate the team members of CIS, IDF, Harmony House Meditation, for continuing this cancer awareness program the last 11 days. Most of the organizations, they do once in a year, and then after that, there may not be any activity at all. Again, they will resurface after 1 year. But here, these organizations are differentiated from rest by continuing this program and imparting knowledge to the society. That's a great thing. And I would like to start my presentation. I would like to structure my talk like a talk for 30 minutes. Then there will be a question and answer session that we will do. Let me go to my presentation. Slide. Is it visible?
Yes, yes, yes.
Yeah. Whenever we start any talk, any discussion on cancer, we always give a little bit statistics, the magnitude of the problem across the globe. As per the latest statistics, there will be 8 million new cases in this year. And also sad to say that 9.5 million people will die of so due to cancer. Coming to India, 14 lakh new cases will be diagnosed by end of December. And the most important factor is majority of the patient, roughly we can say 70% of the patient comes with an advanced stage disease. And cancer can be considered third largest killer in third world countries, including India. Then what is the projection now? By the year 2030, there will be 27 million new cases. And over 17 million people would die of cancer. And another important statistics is 70% of these deaths come from developing countries. Usually people, whenever they talk about cancer, they always think this is a new disease. No, it's not a new disease. Cancer was diagnosed around 500 years before Christ, and it is recorded by the historian Herodotus in his book, The Histories. And also, to give you some idea about what cancer is, I'd like to mention about cell division. Our body is made up of trillions of cells, maybe around 37 trillion cells. All these cells come from one single cell, and it undergoes division, and then we get the 20, 30, 35 trillion cells in our body. But all this division, all controlled by the gene present in the chromosomes, which is located in the nucleus of our cell. So if there is some problem with the controlling gene, all this cell division will go haywire. That will lead to tumor formation. See, a head of a pin that size will be having 1 million cells. The small grape cell will have 1 billion cells. So when you see a small swelling in the neck or in the breast, we can imagine how many billions of cancer cells will be there. Also, we all know about the cause of cancer. The main factors which are associated with genesis of cancer are tobacco, alcohol, food, lack of exercise, obesity, infections, chemicals, drugs, radiation, and genetic factors. We know that tobacco is the main villain in carcinogenesis. 30% of cancers are linked to tobacco. Usually 14 sites in our body develop cancer by exposing those cells to tobacco. It can be smoking, or it can be chewing, or any form of tobacco usage is injurious to health. The main sites are oral cavity, lung, throat, food pipe, bladder, prostate, and pancreas. Sometimes we see patients without any history of smoking. Then, if we probe further, see there will be a history of passive smoking. It usually affects women and children and co-workers. So passive smoking is also as injurious as active smoking. And smokeless tobacco is also very important in the genesis of cancer. Why it's so important? There are 3,000 chemicals in smokeless tobacco, and there are 28 carcinogen. Carcinogen means cancer-producing agents. Whereas when you burn tobacco, it's around 60 cancer-producing substances. There are different forms of usage. One is you chew it or put the tobacco products in the nasal cavity. There are various products are available in the market in Southeast Asian countries. Pan masala, gutka, hands. And it's very alarming to note that 10% of children in India use, for that matter, children in Bangladesh, African countries also use smokeless tobacco. Of this 10% of children, 2 to 3% of children continue that habit. So that leads to different types of health issues. We know about alcohol. Alcohol is linked to 5% of cancers. And which are the organs? Mouth, throat, foot pipe, liver, and breast too. Chronic use of alcohol or consumption of alcohol produces cirrhosis of the liver. From that, usually liver cancer develops. We know about food and its association with the cancer. Contaminated with vegetables and fruits which are contaminated with pesticides and chemical. So one of the reasons for cancer. And so is red and processed meat. That is also can be considered as a carcinogen. Similarly, if salted fish is roasted, it can also produce cancer-producing substance in that process. And also food with the preservatives, synthetic colors, and saturated and trans fat. So all linked to either directly or indirectly the genesis of cancer. And another important factor is lack of exercise, overweight, and obesity. Excess body fat, high consumption of red meat in adolescence and early adult life, and lack of exercise can lead to overweight and obesity. So indirectly linked to a battery of cancers like colon cancer, cancer of the pancreas, uterus, breast, etc. And again, low intake of fruits, vegetables, low intake of fiber are all associated with cancer genesis. We can identify this actress, Angelina Jolie. 8 to 10% of cancers are genetically produced. We get it as a gift from our parents. Breast cancer, colon, prostate, all these cancers has got a familial family involvement. But that's not, it's only 8 to 10%. Angelina Jolie's mother and also her grandmother. Mother and grandmother both had cancer. So Angelina Jolie underwent gene assay and she underwent prophylactic preventive mastectomy, etc. You might have read in the newspaper. And Dr. Chitra may be elaborating on this. The infection is also an important factor in genesis of cancer. Usually this particular aspect is not discussed very widely in the meetings. So I'd like to bring your attention to these common organisms which are associated with certain type of cancer. We all know about hepatitis B and C, so linked to liver cancer. Similarly, the cervical cancer, the main causative or the organism associated with that cancer is human papillomavirus. And H. pylori is another organism which is indirectly linked to genesis of stomach cancer. And we know about HIV, which is responsible for AIDS. It's also associated with a certain type of cancers like sarcomas, lymphomas, and other things. So most of these causative factors can be controlled or can be prevented if we take a judicious decision in our life. And it is important to know about the warning signs because that will help us in early diagnosis and early treatment. We know that most of the cancers present as lump, for example, in the breast, or some type of swelling in the armpit or in the neck. If that particular swelling doesn't subside with the usual treatment, one should be a bit careful about that. Any unusual bleeding or discharge from any site of the body, if the uterus or the vagina, or from the mouth, or from the lung, or from the rectum, yeah, we should give some importance to that. The number 4 and 5, more important for those who smoke or chronic smokers. If a person develops sore throat, or if he or she develop persistent hoarseness or dry cough, yeah, maybe some early symptom of cancer in either in the throat or in the lung. Similar difficulty in swallowing is maybe an important symptom of cancer of the food pipe. Usually it starts with difficulty in swallowing solid food. It will graduate to semi-solid and the liquid food, especially if he smokes or takes alcohol, the chances for having a cancer in the food pipe is more. Bowel change in the bowel habits and bladder habits also should not be ignored. Loss of weight is also a non-specific symptom of cancer. Suppose if somebody loses weight, 10% of its body weight over a period of 4 to 6 months, yeah, that we have to give some relevance to that particular symptom, especially when that person is not dieting. And fever lasting for more than 3 months, it recurs after treatment. There may be an underlying cancer like leukemias, lymphomas, and such things. And also, we know that ulcer, a chronic ulcer, especially in the tongue, on the lip, on the cheek, which doesn't heal after proper treatment. Yeah, we should not ignore that symptom too. All these symptoms do not mean that somebody is going to develop cancer or something. But the take-home message is, if those symptoms do not subside with the conventional line of treatment, and if it progresses, then we should not keep it. We should consult the doctor and follow the doctor's advice, because we can pick up the cancer if those symptoms are due to cancer. And giving the right treatment at the right time guarantees cure in majority of cancers. How will you diagnose this and how will you stage the cancer? Biopsy is the litmus test to diagnose cancer. Take a bit of tissue and process it and use the microscope to find the characteristics of those cells. And also further studies can be done by special investigations. We call it as IHC, or immunohistochemical studies. With that we can analyze and subcategorize the cancer. It's very useful and also very helpful to giving proper treatment for the person. How can you get the biopsy? Usually, if the tumor is the lump, the breast or the thyroid or the surface of the skin, it is easy. But if that is inside the body, then we have to follow a procedure called endoscopy. What is the procedure? A flexible plastic tube with a small tiny camera will be introduced into the body. You can see this is endoscope. A small tube is introduced through the anal orifice. It goes through the rectum, go to the sigmoid, and a camera is there. The doctor can visualize the inside, and the doctor can take the biopsy. And also we can almost same procedure for a lung tumors too. We can do a bronchoscope. You can put into the trachea to the lung, and we can take the biopsy. And also we can assess the urinary bladder. You can put a cystoscope through the urethra. It will reach the bladder, and then we can assess the bladder. So there are different ways to get the tissue, and we have to process it and we have to diagnose it. And other tests are also very important, especially for staging of the disease. For example, X-ray is very good. Ultrasound scan, we know it's a very common tool. CT scan, MRI. PET scan is also very good for staging of the disease. And also remember, there are some blood tests which will help us in assessing the tumor status. They are called tumor markers. For example, in colon cancer, one particular protein is elevated. Usually that will be elevated. That is called carcinoma immunity. This is a protein. Prostate cancer, this is a protein. And ovarian cancer, CA120. But these tumor markers are not very diagnostic, but that will help us in assessing the response to the treatment, and also in assessing it's very important for follow-up too. And also of late, gene profiling is coming in a big way onto our country too. It will help us in deciding about specific treatment. But the important modalities treatment of cancer. One is surgery, you know that. It's a local treatment. That the tumor is localized, yeah. Surgery can give good control. And also it's helpful in diagnosing the tumor also. In early stage tumors, for example, in tongue tumors, bladder tumors, cervical cancers, prostate cancer, all very early disease can be cured with surgery. And also another form of local treatment is radiation therapy. As you can see, this is all very advanced radiation unit that will also take care of the local issues. It also is important for giving palliation. Suppose there is bone pain due to metastasis or something, then radiation is a good effective tool for palliation. And chemotherapy. Usually most of our patients, they come with advanced stage disease. That will not be a localized problem at all. In that situation, yeah, we can use chemotherapy, which will reach almost all parts of the body. And also in leukemias, lymphomas, and all we use chemotherapy. And also a new form of treatment is called targeted therapy or biotherapy, or also called bullet therapy. It's very effective because when we give chemotherapy, the normal cells also will be affected. But when you use bullet therapy or targeted therapy, only the cancer cells will be destroyed. We cannot employ this particular treatment program for all types of tumors, but those tumors which have got the right cell or right receptors can be targeted because side effect will be less. Also hormonal treatment is very effective for breast cancer, prostate cancer, etc. And also another new branch of oncology is being evolved is immunotherapy. And immune system is an important factor for genesis of cancer. So we can boost the immune system, immunotherapy. And it is being widely used in lung cancer. And also gene therapy is also being used in the West, especially in the treatment of leukemias, and lymphomas. What are the most common cancers? Cancer of the lung, prostate, oral cavity, food pipes, stomach, colon. These are the usual cancers affecting men. Except prostate, this can affect female too. But 50% of cancers affecting male in third world countries can be prevented because we know the reason for most of these cancers. Oral cancer, yeah, we know that tobacco and alcohol or poor oral hygiene, sharp tooth, and all responsible for oral cancers and some type of infection, for example, human papilloma virus infection. It's also produce cancer of the throat. So if any change like this in a tobacco user, we have to be careful, ulcer or white patch. Yeah, if that is not responding to some fissures, you should consult your doctor. You can identify, this actor, Sanjay Dutt. He's undergoing treatment for lung cancer. Smoking is the most important etiological factor for lung cancer. It contains more than 60 cancer producing substances. See the pic of a smoker's lung, so deposited with the tar and cancer producing substance. It's the normal non-smoker lung. But then of late, the statistics which released in September this year found that non-smokers also get lung cancer. The main reason for that is found to be air pollution. So one need not smoke always to get lung cancer. Even exposure to this type of cancer producing substance which is present in the air we breathe can also produce lung cancer. Usual investigations will be chest x-ray. I already mentioned about bronchoscopy. And also then we take the biopsy, we do the immunohistochemical studies, all those investigation and precisely stage the disease, then give the right treatment. And this is a cancer exclusively for men. Prostate is not there in the females. This is the prostate gland, which is situated below the bladder. And urine collected in the bladder will pass through this prostate and will pass through the urethra. This usually affects 50 plus male. So one should know about certain symptoms which can be due to prostate cancer. Suppose there is some difficulty in passing urine, or if one urinate frequently, especially at night, inability to urinate, blood in the urine, or such symptoms, if that is not responding to the usual treatment, in a 50 plus male, yeah, we should think about the chances for prostate cancer also. These symptoms can be there to non-malignant conditions, benign prostatic hypertrophy, even so there is some infection, all these symptoms will be there. So the wise thing is, suppose such symptoms are there, always consult your doctor. We can see there's a tumor in the prostate. Okay, again lung cancer, certain symptoms that doesn't go away after 2 to 3 weeks, frequent chest infection, coughing of blood. All these symptoms can be due to lung cancer in a smoker. And also coming to colorectal cancer. Yeah, I know that you identify this actor guy. You might have seen the famous Hollywood film Black Panther, and Boseman was the hero in that. He died at the age of 43 due to colon cancer. So we usually talk about the incidents. Whenever we talk about incidents, we say it's a 50 plus, but that we do see people at a younger age also develop colorectal cancers. This is the anatomy of colon. You can see this in a ascending colon. You can see appendix. This is a small intestine with joint here. The transverse colon, then the descending colon, the sigmoid colon, and the rectum. So digested food will pass through these lumens and will come out. You can see a small polyp. It's a colonoscopy picture. This year there will be around 73,000 new cases in our country. There may be around 1.4 million new cases worldwide, and third most common cancer worldwide. Let us see who is at risk for colorectal cancer. Age is an important factor. As age advances, the chances for developing colorectal cancer is get high. Suppose there is a family history of colon cancer. Yeah, risk is more. And if there is a history of polyp in the colon or in the rectum, finger-like growth in the rectum or colon, the chances are more. If there is other comorbidities like ulcerative colitis or Crohn's disease, sometimes there is a slight, people develop, not all, but there is a slight higher risk. It's very important. Another factor is consumption of red meat and also no physical activity. All these factors are important. All these factors are directly or indirectly linked to colorectal cancer. So most of this can be controlled by modifying our lifestyle. What are the signs and symptoms? There can be no symptom, maybe dull pain sometimes, bleeding per rectum, and bowel habits maybe undergo changes, like maybe diarrhea alternating with the constipation, weight loss. So all these symptoms can be, but it can be due to other benign conditions and other issues too. What are the investigations? Yeah, you have to get a biopsy. So if the tumor is in the sigmoid region, the lower part of the colon, a sigmoidoscopy is good. Yeah, sometimes we have to assess the entire colon. It's called a colonoscopy. Small polyps can be removed if suppose there is a polyp. Even small changes less than 5 millimeter also can be assessed with the help of colonoscopy. And it's an important tool for the screening of colon cancer. Once there is a diagnosis, we have to stage it properly with the help of PET scan, etc. Gene profiling all can be done. And surgery for early cases, surgery is the treatment of choice, should be the first line of treatment. Depending on its stage and other disease, other issues, sometimes we give chemotherapy. And also sometimes we give targeted therapies. Sometimes radiation, especially for tumors in the rectum. In advance, in certain situation, you have to do a colostomy, that is, you'll bring out the part of the colon to the external surface of the abdomen, put a bag there. Not in all cases. In some situation, we will have to integrate all these treatment modalities depending on the stage of the disease, that you leave it to your oncologist. How can you prevent? Regular screening, colonoscopy is an important method. When we screen, we can remove the, if at all there are some polyps or some finger-like growth, we can remove it. We can diagnose things. Pancreatic cancer is also very difficult to diagnose in most of the situation. It's the 11th most common cancer in India. It's very low. The cure rate is very low because usually we detect very late. But if we can detect early, it gives good cure. Some lifestyle factors are also involved in that: alcohol, smoking, dietary habits. You can see pancreas is situated near the stomach. What are the symptoms? Vague symptoms: backache on lying down, vague abdominal pain. As disease advances, jaundice can be developed. So those symptoms may be there. We always talk about diet and cancer. Is fat in diet important for us? Yeah, a lot of studies have shown that there is an indirect relationship between fat in diet and cancer. High intake of total saturated fat is associated with an increased risk for breast cancer, colon, prostate cancer, etc. Animal fat is also not very advisable. Fish is it's okay because it contains omega-3. And also low fat diet can reduce the risk. So fat is very important. It's an important factor in cancer genesis. Those who take the following items tend to have low incidence of cancer. Those who take fresh vegetables, leafy green vegetables, lettuce, raw and fresh fruits, cruciferous vegetables, it's all associated with the lower risk of cancers. But always remember, when we use these type of food items, it should be washed properly because we have to be very careful about the pesticides and chemicals present in the vegetables. Why should we care about fruits and vegetables? Good source of fiber, vitamin and mineral. Besides, it contains antioxidants, phytochemicals, phenols. All these agents will prevent genesis of cancer to a certain extent. It may not eliminate cancer, it may not prevent it completely, but then it will help us in a big way. How can you modify your lifestyle and how can you achieve cancer prevention to a certain level? One should be physically active for 30 to 45 minutes for 5 days in a week. Oral hygiene should be maintained. We should keep ideal body weight, use less saturated fat and trans fatty acids, a big no to tobacco, no alcohol, pesticides-free fruits, vegetables, grains, soya protein, soya. Also try to avoid roasting, barbecuing, etc. And also an important tool of prevention is vaccination. We know that hepatitis B vaccine, it prevents hepatitis B virus related liver cancer, and also human papilloma virus vaccination that Dr. Chitra will be discussing. Why we are giving much importance to cancer? It's a critical health problem and it's a human issue too. Around 10 million people die every year. The most important fact is around 35% of cancers can be prevented. So this is the time for us to act. Yeah, do you have the power to reduce the impact of cancer? What will you do? Our personal commitment to take a positive action against cancer is very important. How can, as an individual, can lessen the risk of getting diagnosed with cancer? Very important. We have to modify our lifestyle and also proper screening for early detection and also proper preventive steps. If you follow those 3 steps, we can keep cancer at bay. Yeah, certain myths are also involved with cancer. People sometimes think it spreads from one person to another. No, it doesn't. If you ignore certain symptoms, people think, yeah, it will not, will go away. No. If that is due to cancer, definitely that will chase that person. And always people may think, yeah, it's hereditary. After smoking for 30 years, when somebody get lung cancer, they always blame their fate. Only 8 to 10% of cases can be considered as hereditary. Cancer is painful always. It's a big problem. People sometimes think it's always no. Small lumps, small swellings will not be painful. Pain will be a late manifestation of cancer. So one should not wait for pain to develop. Cancer is incurable. It's a myth. It is curable if you detect it early and if you give the right treatment at the right time. So detection alone is not enough. Majority of the patients in underdeveloped countries may not get the right treatment, the adequate treatment at the right time. Cancer patients is not treatable, that's also a myth. Yeah. Very effective methods are available now, ranging from tablets to patch. A lot of drugs are available. So cancer pain can be treated very effectively. Cancer doesn't mean death. It's not a death warrant at all. Always we think that it doesn't affect me. That's also wrong. It can affect anyone. It doesn't differentiate people on nationality or caste, creed, age, gender, nothing. So we should not believe these myths about cancer. We have to be, how can you help others? When we talk about help, people always think about money. It's not money which is important. It's important, but then if at all we don't have money to donate, we can empathize with the persons. We not sympathize with them. We can empathize with them. Say good words, motivation, encouragement, tell good stories about cancer survivors. All everything will be very helpful, will be a game changer. You can also visit for more information, you can visit my Facebook page. So you can WhatsApp me or you can mail me. Yeah, I have got a brief introduction on cancer. I not dealt with the female cancers that my friend will be dealing with that. If there's some questions, either we can discuss now or we can discuss it later.
Yeah, later we will take. Thanks a lot, Doctor, for your detailed and I would actually personally take the point that early diagnosis is the key to cure. And really, it's so helpful. And you raise this very simple but very important things like our diet and lifestyle, because other things are beyond our control, but at least we can control what we eat, and we exercise and take more fresh vegetables and fruits. And it was really, really enlightening for us. Yes, Darshana, please, we will take the questions later. Okay, so now I would invite our next doctor, Dr. K. Chitradhara. Please, can I see doctor?
Yes.
Okay. So we have with us our very special doctor. She is the director of the, sorry, 1 second. Director of Institute of Gynecology and Breast Sciences, VPS Lakeshore Hospital, Kochi, India. And very, very special, our doctor is, and I was reading about few points in her biodata that she actively participated in the development of surgical and gynec oncology as a separate specialty in Kerala. And the very beautiful thing is first lady urologist of Kerala. So we are very, very honored to have you, doctor, with us today, and started Kerala's first gynecological cancer surgery unit at Regional Cancer Center, Thiruvananthapuram in 1993, and urological oncology in 2009. She edited 3 books in gynec oncology, authored Malayalam book, and published more than 40 papers, actively involved in cancer awareness and early detection since 30 years, and received many awards and about her work. And like Dr. Duru Shah Distinguished Community Service Award 2014 for the work of cancer awareness and early cancer detection work in the community, and Mahatma Gandhi Peace Foundation Award, and many from state level organizations. So we are looking forward to your enlightening talk, Dr. K. Chitradhara ji. Over to you.
Warm wishes from Kochi. Thank you, Pavitra ji, for the kind introduction, kind words. I extend my thanks to all the organizations, Center for India Studies, Indian Doctors Forum Kuwait, and your Harmony Meditation House. And it was really interesting to hear Munaji, her experience and her journey in the inner discovery. And I and Dr. Surendra ji, and also Vibhesh, because he always contact us, continuously send messages, and I extend my heartfelt thanks to him. Shall I share the screen?
Yes, you can share.
For a cancer to occur, there should happen a genetic change. This is true for breast cancer also. because I'm dealing with the female cancers. I'm mainly talking about breast cancer, then uterine cervical cancer, and then a little bit about uterus and ovarian cancers. And so I'll be talking a little bit about lifestyle factors connected with breast cancer. Then what are the preventable factors? Then screening tests, that is tests for early detection, then genetic testing and prevention. So I think I can shed some light on these factors. And 98% of the time, cancer is linked to lifestyle factors. And this is actually, this is true for, as I told you, for the breast cancer also. These are the main lifestyle factors involved in breast cancer. This just already talked so much about tobacco, alcohol and all. Smoking and tobacco, then alcohol, diet and physical activity. Then other two are not very important in breast cancer, obesity and diabetes. So I have seen so many women smokers in the airports and mainly abroad airports and also in hotels, 5-star hotels. And when you see, because actually in Kerala and India, it is public smoking is banned. So you cannot see many smokers here in Kerala in public places. A person can develop cancer due to active smoke, the effect of active smoking or passive smoking. You can see this person carrying the child. The child can develop cancer in two ways. One is active, one is passive smoking. The second is the genetic change, which occurs due to the smoking is transferable, that is transferred to the child. So the child is vulnerable for development of cancer in two ways. And now we are using mask, and it is presumed that the cancer, the incidence of cancer and other airborne diseases can reduce, you can see a reduction in the incidence of cancer and all these diseases probably in 5 years time because of the use of this. If you continue to use it, it would be better. And this is how we are now seeing the patients. The patients are sitting either 1 meter to 2 meter away from us, and we are using mask and then shields to see the patients because of corona. And this use of mask reduces the effect of passive smoking also. And the passive smoking is linked to the breast cancer in postmenopausal women. And active smoking is linked to breast cancer in premenopausal. Premenopausal before the menopause. Premenopausal women, the word itself implies. And the passive smoking is important in development of breast cancer in postmenopausal women. And regarding the alcohol, people, even women are very interested in taking or enjoying alcohol for the celebrations, get-togethers. So you can see 7 type of cancers here. And the second in incidence is breast cancer, which is linked to the alcohol. First is bowel, that is intestinal cancer. And then diabetes. Diabetes is a common problem in women also. And also hypothyroidism, that is deficiency of thyroid is 10 times more likely to affect women than men. And a little bit more about the diabetes. This is the incidence, the data of our institution. You can see the incidence of diabetes in breast cancer patients. It's around 27%. That is more than 1/4 of the patient is having diabetes. And you can see now recent studies showing that there is a link between type 2 diabetes and cancer. And you can see it is there is a horizontal pleiotrophy and also a vertical horizontal transmission and also a vertical transmission in diabetes. And there is a link between risk of genetic variant, a link between the type 2 diabetes and cancer. And in the vertical transmission, you can see type 2 diabetes is surely a risk for cancer. And another is this, actually diabetes is the lack of usage of insulin at cellular level. They cannot use insulin. They cannot use insulin. So the insulin, actually the insulin level, glucose and oxygen use is reduced at cellular level. So the insulin will go up, insulin level will go up. So this is the main cause for diabetes. So then the insulin level will go up, then that itself is a risk factor for cancer. Hyperinsulinemia. Then other is obesity. Obesity also increases the risk for cancer, because naturally I'll be coming to these things a little later. I think I'll be, that slide is missing. And diabetes is, let me see that slide is later on, it is coming. And there's a polycystic ovarian disease. This is very common in the adolescent group and young adults, young women. So up to 36% is the incidence of this polycystic disease. Why it is so important in adolescent and women? So polycystic ovarian disease, it is the small cyst are found arranged in the periphery of the ovary. So the ovulation does not occur. So what are the problems with this? Actually, this is called as a thief of womanhood. So these girls will be having a male distribution or abnormal distribution of hair. That is, and they will be having pimples or acne, and there will be 80 to 95% of the people will be having menstrual problems, or lack of or delay in the menses, or it may not occur at all. And 92% will be having emotional problems. So that is why they are a little different from the general women. That is why it is said that it is a thief of womanhood. So actually, we should prevent it from becoming a killer of the womanhood. So there is usually an insulin resistant. That means they cannot use glucose at cellular level. So the insulin level will naturally go up. This, what is happening at cellular level, is equal to that of diabetes. So the insulin level will go up. So type 2 diabetes occurs, and there will be chance for high cholesterol. There will be chance of high blood pressure, and there is chance of heart disease. So how to control this? So it can be easily controlled with lifestyle modification and mainly diet modification and exercise, and then counseling for emotional problems. So even in 90% of the people will be obese, but even 5 to 10% can be lean. But even with the lean people, the exercise can cause wonders. Even the menses can become regular, ovulation occurs, and naturally all these things can be reversed by exercise and diet, mainly exercise. And see, polycystic ovarian syndrome is associated with the endometrial cancer. There is a 6 times increase in the chance of uterine cancer. The uterus has got 3 layers. The lining of the inside of the abdomen is the outermost layer, and middle layer is the layer of muscles, that is called myometrium, and the inner lining is the endometrial lining. So the endometrial cancer, that endometrial lining cancer is the most common, and that is 6 times more common in PCOD, polycystic ovarian cancer patients. And it doubles the risk of ovarian and pancreatic cancers, and it also increases the breast cancer risk. Breast cancer risk is increased by generally by obesity. Then there is I told you there will be increase in the insulin level in the body. Also there is increase in the male hormone, that is androgen level in the body, and this again increase the estrogen level, that is female hormone level in the body. These things are attributed These things are responsible for the increased occurrence of breast cancer. Increased insulin level, increased male hormone level, then increased female hormone level. Why male hormone level is responsible for this? Because the male hormone present in the body is converted to female hormone, estrogen, in the fat, in the adipose tissue, because most of them are obese. So this male hormones will be converted into female hormone estrogen. And this is responsible for the overgrowth of endometrial lining, and also it can cause the breast cells into the increased proliferation space. And it causes the polycystic ovarian disease causes infertility and lack of ovulation. That also is supposed to be a cause for the treatment and the basic pathology itself is maybe a cause for breast cancer. And why I am talking about this polycystic ovarian disease? Because adolescent, because of these hormonal problems and absence of menses, many people are given hormones. But this is not the drug of choice in polycystic ovarian disease. This is the we have to advise the woman to go for diet control and exercise. And the drug of choice is the anti-diabetic drug metformin. So the use of hormones have to be discouraged. Then in obesity is also again as cause for adult obesity, especially the weight putting on weight after the adolescent period. So adult obesity is responsible for the breast cancer. Then obesity is linked to endometrial cancer again, and it is 2 to 4 times greater in greater incidence causing endometrial cancer. And there is a corpus cancer syndrome. That is diabetes, obesity, then increase in cholesterol, which causes that's called as metabolic syndrome, which is mainly responsible for the endometrial cancer, especially. Then this colorectal cancer is also high in obesity. Then so many cancers the incidence is high in obesity, kidney cancer, esophagus, because that is food pipe. They mainly lower 1/3 is important, and then prostate cancer, pancreas, and liver cancer. Now I'll be coming to to breast cancer per se, and why I'm showing these celebrities, because there used to be some myth and misunderstanding. Even now it is not gone completely, especially in this part of the country, Kerala or India as it may be a little, but Kerala it is very high. It is a social stigma attached to the cancer. So many people won't come out for the screening test and early detection, and even they don't come for even treatment, leave alone early detection. And this is Sri Vidya, you know her very well, and she denied the treatment, telling that it will tarnish her image. And this probably Ragini and all developed breast cancer so early. But outside India, especially UK, USA and all, there is a tendency to tell that I'm suffering from breast cancer, I can help you, I will make you aware of the symptoms, or I can do all help for everything. So such is the attitude of the abroad people. And you know, this is Nancy Reagan, a long-term breast cancer survivor, and Betty Ford, and so many other celebrities. And now mainly I'll be dealing with the prevention, cancer prevention, mainly the primary prevention and the secondary prevention. And regarding the primary prevention, when you talk about primary prevention, there should be a known cause for the cancer. But breast cancer, there is not the single cause cannot be attributed to breast cancer. So I've told you so many factors which can contribute to the genetic change. Genetic change, mainly 80% of the cancer occurs due to breast cancer, the genetic mutation occurring in breast cancer 1 and breast cancer 2 genes. These are called tumor suppressor genes, and these are driver genes, because the main prominent gene mutations occurring on these genes. So these are called driver genes. So because of this, 80% of the mutations occur in the 80% of the time breast cancer is due to the mutation in these genes. So, and 20% can be due to a mutation of the some other, apart from this, other few genes are also attributed to this. And when you talk about primary prevention, it is the cause is known, and we can eliminate cancer by preventing that cause. The main dominant factor in this primary prevention is a vaccine. I'll be coming to the vaccine later regarding the cervical cancer, but breast cancer, as far as breast cancer is concerned, even now the important factor is detecting the breast disease, breast cancer early, sufficiently early, so that we can treat it to the cure. So these tests which are used for the early detection of breast cancer are called screening tests. All cancers, if you do a test to detect it early, it is called a screening test. Screening test for all the diseases, even for you must have heard of screening during pregnancy to detect congenital diseases. So any disease that can be detected early by screening test. Those are called screenable diseases. For the cancer, these are called screenable cancers. So when you come to the screenable cancers, these are cancer of the cervix, breast cancer, then oral cancer, oral is mouth cavity, then colon, intestine. Dr. Mohannar has already talked regarding this cancer, then prostate cancer. Even though it is only 5 cancers, mainly 5 cancers, it will constitute roughly around 60 to 70% of all cancers. So when you come to the breast cancer, what are the risk factors involved in? I told you regarding the lifestyle factors involved in or connected to the breast cancer. And again, this can be divided into non-modifiable risk factors and modifiable risk factors. And when you consider non-modifiable risk factors, first is age, then gender. Female gender is itself is a risk factor, because breast cancer can occur in males also. And then family history, personal history of any breast changes, then age at menarche and age at menopause. If the early age menarche comes early or menopause is late, there is chance of the increase in chance of developing breast cancer. A basic assessment of the risk depends on how long the female hormone acted on the breast. From the menarche to menopause, what is the how much years it acted on the breast, mainly the female hormone estrogen. So this age at menarche and age at menopause also, you can now tell that depends on the diet and all environmental factors also. Even though it is written as a non-modifiable factor, probably diet and exercise can delay the menarche, or early menopause can occur with these things. And modified risk factors, again, obesity. I've already discussed something about obesity. Then alcohol is another modified. Then hormone replacement therapy. So many hormones are used after the menopause to reduce the symptoms of menopause. So when you use the hormones, there is increased chance of developing the breast cancer. But this is more especially when combined pill is used. That means a combined pill is there are main 2 female hormones are there. One is estrogen and another is progesterone. When you use estrogen and progesterone pill for reducing the menopausal symptoms, there is an increased risk of developing cancer. So if you want to use a hormone for hormone replacement to reduce the symptom of menopause, it should be a hormone which contains only one hormone, mainly the estrogen. and low dose of estrogen, and you should use it for a very minimum period to reduce the symptoms only. Should not continue long. Very short period you can use, and estrogen only with minimal dose you can use. And again, the birth control pills itself, it is written that it can increase the incidence of cancer. And age at childbirth and breastfeeding, again important because of these hormones only. If the childbirth occurs after the age of 30, the chance is high, the incidence is high. And breastfeeding, if the breastfeeding is long, the chance of development of breast cancer is less. Why? It is because of the breastfeeding, and hormone prolactin is produced, and this will neutralize work against, or it is against the female hormone estrogen. So that reduces their chance of developing breast cancer. So these are the non-modified risk factors. Age is a very important factor of development of all cancers. As age increases, the incidence also increases. This is same for the breast cancer also. And gender, I told you, female gender itself is a risk factor. Male can also develop breast cancer. That is very rare, probably 1 in 1,200. Female, it is 1 in, depends on the age. If we take 100 cancers, female cancers, it is around 40%, but otherwise it is probably 1 in 120. And the genetic risk factor, it is only 5 to 10%. The main mutations are occurring in breast cancer 1 and 2 genes, and it is usually in 5 to 10% of the cases, it is hereditary. It is inherited from the parents, and it is a germline mutation. But I told you a mutation has to happen before the development of breast cancer. Even if it is non-hereditary, it has to happen for the development of breast cancer. That is called somatic mutation. But that is during their life, the cells are developing a change. The gene is developing a change that is mutated. And this is particularly seen only in the tumor, the somatic mutation. The other, you can find it out by a blood test also, germline mutation. But when there is a family history, actually there are 2 arms for the gene. So one arm is inherited from the father, from the parents, and the other arm has to damage during their lifetime for the cancer to occur, even in hereditary. So this hereditary cancer also can be, the incidence can be reduced by all the lifestyle changes and all the whatever preventable measures we are taking. This can reduce even the incidence of hereditary cancers also. And if the number of family members are increased, again the greater the chance of developing cancer, breast cancer. And also when the family members are affected, when they are less than 50 years, there will be increased chance of developing breast cancer. And or the closer the family member, the greater the risk. You see, the breast cancer risk is in BRCA mutation, 1 mutation, it is roughly, it can go up to 85% to 90%. And BRCA2, it is up to 85, because it is little less than the BRCA1 mutation. And the ovarian cancer risk is also increased by the BRCA1 mutation, as Dr. Mohan Nair told regarding the Angelina Jolie, and it is 40 to 50% risk of developing ovarian cancer when BRCA1 gene is mutated, and it is less when BRCA2 is mutated. But for the male cancer, it is usually the BRCA2 mutation is responsible for male breast cancer. And once, if a male family member is affected by breast cancer, we have to put other female members of the family on active surveillance. Or we have to check we have to go for the genetic testing and do the preventive surgeries. This already is, and especially this oral contraceptive pills taken during the adolescent. That is why I talked about polycystic ovarian disease also. If the one takes these things during the adolescent period, there a lot of changes can occur in the breast because it is during the development period. So a lot of changes can occur and it can later lead on to the breast cancer. This is a chart I've already talked to you regarding this. And now we have come to what are the important screening tests in breast cancer. One is breast self-examination, second is examination by physician, third is the mammography, which is most important. Physician examination, actually, we are not promoting because so many errors can happen. Even American Cancer Society is not promoting breast examination by the physician. Breast self-examination, we can otherwise call it as breast self-awareness. One has to have a good awareness of the structure of their own breast, so that any change which is happening in the breast can be detected by their palpation or their appearance to that person. These are so for the breast cancer to treat it, to cure, we have to detect it at a very early stage. This is a one milk duct I'm showing. You can see the cells piled up inside the milk duct. So this can be detected by an ultrasound, and this cancer occurrence can be prevented by removal of only this milk duct. We can prevent the development of a cancer. This can be detected by an ultrasound. So you can see this is the regular arrangement of the cells, which is seen normally. And this arrangement is called convent girl appearance, because everything is size, shape, everything is uniform. You can just like a uniform wearing girls in a convent. You can, it is called this arrangement is called the convent girl appearance, and this arrangement is called the college girl appearance. So this is exactly what we are seeing under the microscope also for the diagnosis of cancer by a biopsy. We are taking a biopsy, and this appearance is seen under the microscope to detect the cancer. And this is a very early cancer. This is not felt on palpation. This is a mammographic picture of, and this white is a cancer. And this is not felt by the fingers. So a wire is introduced into this mass and is taken out. So we have to detect this early for the cancer to be cured. These are all very late cancers. Even people are coming with this type of ulceration and advanced stages. So what are the steps in breast self-examination? It is an examination, mainly 3 steps: inspection before a mirror. Then we have to do the examine breast or lying position, and sitting or standing position. Mainly semi-prone position is most ideal. And when to do and how to do the breast self-examination. How to do means we have to palpate the breast only with the palm of the fingers. Otherwise, we will feel the breast lumpy and will be panic. So breast should be examined with the palm of the fingers only. Should not hold the breast tissue and see for the breast self-examination. And it can be done either from periphery to central, or from down to up, or up to down, or in a concentric manner rounding the breast. We have to see the armpit also for detection of any lump in the armpit. And when to do in a lady who is menstruating, we have to the period of breast self-examination should be the initial period. We should not examine the breast during the premenstrual period. It should be in the first half of the cycle, mainly after 8th day of the cycle. And in postmenopausal, we can fix up a date so that we can examine the breast once a month, or once in 2 months. And this is a mammogram, which is just a imaging of the special imaging of the breast. 2 plates, the breast is compressed by 2 plates, and we are getting an image of the breast. And this is very important because it can detect even precancerous lesions. This is a mammogram picture. This you can see the background is quite dark, And this is the cancer, so that this mass is detected very easily. And we can see sometimes some minute white spots, which we call it as microcalcification, and these are some precancerous lesions can be attributed to the microcalcification. So precancerous lesion can be detected by the mammography, and very early cancers and even precancers can be detected. And in this picture, you see this entire breast looks bright, white. So with this picture of the mammogram, we may not be able to detect tumors here. So after seeing the first mammogram, doctor will decide which follow-up investigation the woman has to do for detection of the tumors. So in this type of mammograms, we don't advise the mammogram testing for the screening, but they can either do ultrasound or an MR mammogram. This is a large picture. And this is an MR mammogram. The MR mammogram is the most sensitive test now for the imaging of the breast and for the detection of breast cancer. This also can, we can use this also for the detection of even precancerous lesion. It can detect even an increase in blood supply to some area, so that we can remove that area and prevent the occurrence of cancer. But this is not recommended for screening as a screening test, because this is very costly test. Costly means when it cannot be used for mass screening, since it is costly, and it is highly sensitive, but it is costly, so we cannot use this for mass screening. But that doesn't mean that the one person cannot do that. Any doubtful circumstances, especially in hereditary cancers and the people when they are young, less than 40 years, MR mammography is advised. Or when there is any doubt on the routine mammography, we can recommend an MR mammography. And what are the drawbacks and advantages of this testing? And breast self-examination or doctor examination, but we are not as such promoting doctor examination now. Breast self-examination, they can detect lumps when it grows to 1 to 2 centimeters only. Very small lumps cannot be detected by breast self-examination. So mammogram is that, that is why mammogram is so important. It can detect tumors even up to even less than 0.5 centimeter and in precancerous stage. And so in such cases, if you detect such cancers, breast conservation is quite easy. So we need not remove entire breast. We can remove that small area and conserve the breast. And sometimes radiation is also not required, and chemotherapy is not at all required if the lesion is hormone tablet sensitive. And then MR mammogram. And further, I'm not going into any details regarding the treatment. This is a diagnosis. For the diagnosis, a triple assessment is done when the patient presents with a breast lump, which is the most common presentation. And in 90% of the cases, it will be a painless lump. So we have to give some emphasis on the painless. People will think that pain is the major symptoms, and when there is no pain, people won't come for the examination. But painless lump, that has to be given more emphasis. Painless lump is more important. That is more dangerous than a painful lump as far as cancer is concerned. 10% of the cancer can present with a painful lump also. But when there is a pain, people used to go to a doctor. But since people will say, I'm not having sin, so I just ignored it. So such things should not happen. A painless lump is the most important symptom. And when the person comes with the lump, we have to go for a triple assessment. That is, the first is history and examination of the lump. We'll get a clue whether it is an innocent lump or a malignant cancerous lump. Then scanning, which are mammography or and ultrasound. Both are important, both are contributory. And when reporting a mammogram, an ultrasound is also taken before reporting the mammogram. And you should not go to a place where only mammogram is done as a part of screening test. And then the biopsy. Core needle biopsy is the standard test now. Needle biopsy, FNAC, fine needle aspiration is not considered a standard diagnostic test now. And what are the recommendations for screening studies? So this is the American College of Surgeons recommendations. Between 45 and 55 years, we have to go for annual mammography. Then after 55 years and less than 45 years, it can be once in 2 months. But depends on your risk of developing breast cancer. You can do it either annually, or if there is a surveillance. If too much close frequently interval you have to do, then the doctor will advise you to do such surveillance or short interval test. But what we suggest is, what I usually recommend people is 1 year we can go for an ultrasound examination. Next year, radio mammogram, and the 3rd year, if there is a family history or there is some risk for the person is there, we can go for an MR mammogram. So we can alternatively once in 3 years we can do this test. So this is all talked about Angelina. And when will you do the genetic test? If there is a breast ovaries in the cancer to that person or in the family, breast and ovary, or when there is a male breast cancer which is occurring in the family, in one of the family members, or when there is a bilateral breast cancer, or when the breast cancer occurs at a very younger age group. And these are the indications for going for a genetic testing. So we have to counsel them adequately for going for the genetic testing, and then what are the other preventive surgeries we are planning to do, whether they are willing to do it. So such things we have to discuss early. If they are too panicky, if they don't want to do the test, then we should discourage that. Nowadays in ovary also, when at the diagnosis of ovarian cancer, especially high-grade ovarian cancer, genetic testing is indicated. So that is a must for all ovarian high-grade cancers. There is no exception for that. And now actually I have prepared few slides for innocent tumors. These are fibroadenomas which occurs mainly up to 30 years. There can be so many innocent tumors in the breast, but only thing that we have to exclude cancer. So we should not think that always that it is an innocent and remain without approaching a doctor or do some other medication and some other medicines, alternative medicines. So most of the lumps we can detect, we can diagnose 99% of the time by a triple assessment. I've already told you, but I'm not going into details of all this short of time. In breast cyst, the fluid-filled masses in the breast is also very common. That is I think that is the most common probably, along with the fibroadenoma. These are the most common lumps which are occurring in the breast. So we should not be panicky all the time that this is a cancer. Whenever you see a lump, we should not think that this is a cancer, but we have to investigate and rule out a cancer. So breast is, once you aspirate, we cannot express in words their joy. The patients, the woman is coming, their joy, we cannot express in, we have to experience that joy. That breast lump is just disappearing with the aspiration of the fluid. And I'm not any doubt. And another which is mimicking a cancer is even in ultrasound mammogram, this mastitis, some infections mimic a cancer. This also diagnosis is finally by corneal biopsy or true cut biopsy. We said another name for corneal biopsy, true cut biopsy. And then this breast part is over. Then I've come to the carcinoma cervix. Actually, you are seeing a lady which I treated when I was in RCC, and this patient actually came with a stage 2 carcinoma of the cervix. But for stage 1, we mainly do surgery, initial surgery for stage 1 diseases. So this patient underwent radiotherapy, but after a few months, or up to 6 to 1 year, 6 months to 1 year, the cancer relapsed or reappeared. So they came for surgery. And that time when it recurs after a radiotherapy, we may have to remove the uterus along with the bladder, which is situated in front of the uterus, and the rectum and anal canal, which I think you must be familiar with the anatomy, because Dr. Mohanan Nair had already shown you. It is situated behind the uterus. Rectum and anal canal situated behind the uterus. So in a radical surgery with the removal of the uterus, urinary bladder and the lower bowel, that is rectum, then only we could clear all the diseases. But we used to do a lot of such surgeries long time back. But now when you are doing such a case, you will be worried, and it is a you will feel really worried. It's not a good thing to do such cases now. And you will be worried that you haven't given much awareness to the society. Why patient has come in such a stage? Why they are not vaccinated? Why they haven't undergone screening test? The screening test in cervix is the most sensitive screening test in detecting a cancer. So as already pointed out, the cervical cancer is in 99% of the cases caused by the virus, human papilloma virus. And this is a landmark discovery in the in cancer research. So after that, after this discovery, we could make a vaccine for this. And this is now that may become a preventable, can be eradicated in near future, cervical cancer, with the vaccination, because just like polio, smallpox, everything is eradicated. So we are hoping that we can eradicate carcinoma cervix also in some time, in a few years. So this is the electron microscopy picture of the cancer cervix. You can see the cervix is the lowermost part of the uterus. So the uterine cancer and the cervical cancer are quite different. This is the uterine body and this is the uterine cervix, the lower 2.5 centimeter. You can see the cervix when you examine the patient through the vagina. So through the down part, we can see the cervix. So after after few years, it has become known that we can human papilloma virus cause not only cervix, it causes many other cancers like oral cavity cancers. 50% of the oral cavity cancers, 80% of the anal cancers. Anus is still, as I told you, it is the lowermost part of the large bowel. The 80% of the, more than 80% of the anal cancer can be prevented by this vaccination, because it is caused by the human papilloma virus, and 50% of the penile cancers. Because penile cancer is very low in incidence in Kerala, probably Tamil Nadu. It is got a, it's more in Tamil Nadu. Kerala is, again, it is less. Again, carcinoma cervix is also coming down in Kerala. The leading cancer in Kerala is carcinoma breast. So everywhere in the world it is like that. So what is the vaccination? What about the vaccination in carcinoma cervix or HPV related diseases? This is taken as 3 doses after the age of 13 years, and between 10 to 13 years, 2 doses at 0 month and second month, 2 doses. After 13 years, we have to take 3 doses, that is at 6 months also. And there are, now there are 3 vaccines available. 2 vaccines are against 2 viruses only. One is 2 high-risk viruses and 2 viruses which are causing benign tumors. Because the viruses which are causing carcinoma cervix are high-risk viruses. Many types of some 10-11 types of high-risk viruses are there, and these are having vaccine against high-risk viruses. And now we have got the monovalent vaccination, which contain 9 high-risk viruses and a few the HPV viruses, which causes the benign papillomas also. So now we are thinking in a short while we can eradicate cervical cancer and vaginal cancer completely, and reduce the incidence of, probably we can prevent, completely eradicate the anal cancer, because more than 90% of the cases, it is due to the human papilloma virus, and we can reduce the incidence of mouth cancers and penile cancers. So, and what are the screening tests for carcinoma cervix? There are two important screening tests. One is a pap smear test, which is there since 100 years, more than 100 years. And the other new test is human papillomavirus DNA testing, HPV DNA testing. This is the pap smear testing. And you can see the cells that I have told you. These are very, very regular shaped cells, and these are malignant, down cells are malignant cells, different shapes and size, collegial appearance. This is the conventional appearance of the cells. And what are the recommendations? If you do pap smear and HPV DNA testing, we need to do testing only once in 5 years. This is known as co-testing. So both the tests are done once in 5 years after the age of, now with the recommendation is from 25 years, but 3 years, probably after 3 years after the beginning of intercourse. Then pap test alone once every 3 years, or if you are doing HPV DNA testing only, we can do it in once in 5 years, because it is the most sensitive test. Even though it is little less specific, it is highly sensitive in detecting the cancer, even in the pre-cancerous stage. Even 5 years prior to its occurrence, it can detect the presence of HPV DNA in the cervix. We can detect even 5 years prior to its occurrence. So when you advise a vaccine, if the woman is less than 30 years, we need not go for an HPV DNA testing. They can straight away go for vaccination. If it is after 30 years, we have to go for an HPV DNA testing, see whether the HPV DNA is there, and then do the vaccination. This is then I told you precancerous, this screening can be done in oral cancers also. This is a white patch in the oral cavity. So you can see this is a person with chewing. White, this is then this red patch. Then this is an early cancer in the tongue. This is probably a late cancer. This is very common in people who are putting these things under the tongue, tobacco under the tongue, nicotine substances, not tobacco. Then regarding this, Dr. Monner already told you regarding the screening test for intestines, that mainly the large intestine, it is colonoscopy. And the test is, the recommended screening test for colorectal cancer is fecal occult blood annually. Then sigmoidoscopy, that is lower part of the intestine every 5 years, and entire colon every 10 years. This is a small polyp which can be seen and removed during the colonoscopy. And regarding the uterine and cervical cancers, only high risk people need to undergo the testing. Ovarian cancers, I've already told you regarding the high risk category of the people with the breast cancer history or an ovarian cancer history for them or in the family. But for these people, when they are going for a screening test, it is better to go for an ultrasound of the abdomen also, because ovarian cancer is now become a challenging cancer. We can detect it at a very late stage only because of the absence of symptoms. So the mortality is very high when compared to breast cancer, or never it is breast, the mortality is because of its number. When you take the number, equal number, ovarian cancer is having higher mortality than breast cancer or cervical cancer. So its early detection is now important, especially in high-risk people. For the general population, we cannot recommend it because it is not a cost-effective testing. So CA-125, serial testing of CA-125 and ultrasound are the screening tests for ovarian cancer. And these are all, I think it's, time is already 11:45. I think I'll just, these are all discussed by Dr. Mohan Nair. The symptoms to be given little attention, these are gaseous discomfort and abdominal pain, because these are important in colon cancer and also in ovarian cancer, gas problems. Then frequency of micturition, if it is not due to, frequency of micturition usually occurs in urinary tract infection, but if it is not due to urinary tract infection, infection, we have to go for other investigation to see whether there is some tumor which is irritating the bladder. So any type of bleeding other than the normal menses, we have to give much care to that. We should be cautious for that. Irregular bleeding, even a single drop of bleeding after the menopause, we have to give attention. Then bleeding through the rectum, we should not think that it is piles. We have to investigate for that. These are all preventive factors. I think it's already discussed. Regarding the breast, have the child before 30 years and breastfeed it, control obesity with diet and exercise, control diabetes. And regarding the cervix, sexual hygiene is quite important. So thank you. I have to hurry a little bit. Thank you. Thank you for giving me this opportunity, Pavitra-ji, and
Thank you, Dr. Chitradhara. Really, with so much patience, you have really, in so much detail and so much patience, you really have given us this knowledge. And if we go into the essence, I would say that it's all about lifestyle. And as you also said, and Dr. Mohanan also said about early diagnosis is the key to cure. And in meditation also, we learn that that any problem mentally also, in relationships also, when something we diagnose early, then we can prevent it. In relationships also,
in exercise we can include yoga and meditation.
exactly,
Nowadays,
meditation and yoga.
using that yoga and meditation.
So it's combination of meditation
Yeah.
and health and like physical health and the health of the mind. So now I would request Monaji. Monaji, are you there to take us to this journey of meditation for a few minutes? Because actually she has another call, but we actually stopped her from going there. Okay, Monaji, over to you.
Thank you, thank you. So thank you all. Thank you, Dr. Mohan. Thank you, Dr. Chitratara, Pavitraji, Surendra Nayak. Thank you so much. So I know the time zones also in India, so aware of all the elements. One thing maybe from what I have heard is the obesity and the exercise, but sometimes what is noticed is that we have deep habits, and you can tell people, please don't eat sugar, please don't eat fat, but they cannot, they say, or let's say if they are alcoholic as well. So for that, actually, they need inner power. No matter how much you tell them this is good for them, it's, I think in Hindi, the word is sanskar. There's deep sanskars in the soul, and it is almost very hard to let go of these old habits and beliefs, maybe. And so I can talk for myself. I was a very much meat eater and chicken and all the best restaurants and all that was part of my lifestyle. But when I started meditation and when I understood the value of respecting your body and respecting the nature, then the key was really understanding. So unless one understands why I want to do this, it's not just about being healthy, yes, of course, but you need power. And that power really comes from knowing yourself and honestly also connecting with the divine. Call it God, call it Allah, there is a higher power that we connect with. And that's where we get the power to let go of our deep sanskars and habits. And so, yes, I think the seed is this higher consciousness. And when we are in tune with ourselves, then actually we will naturally do the right thing. And this comes from inner security, because many times I notice even with friends, and it's all emotional eating, it's boredom, when people don't have really a clear purpose in their life, then there is boredom and there is overeating, or you don't have the enthusiasm to exercise. You need to have really a clear aim and objective in your life to be able to change your lifestyle. And for me, really, the key is knowing yourself. So, not to take from your time, and thank you again for having us. Yeah, let's start just by having a few minutes of contemplation. And for meditation, we always make sure that the body is in a good posture. And just take a deep breath, relax even more. Let go of any tension that is anywhere in the body. And we can say that the seed of choice is really the thought. Everything starts with a thought. And so, in silence, we come to know that there is a consciousness, there is a being in this body. And this body, not the soul, we call it the Atma, or the being, the spirit. When the soul of the body, we can see the body, we can see the brain, but there is no life. So we are actually life. We give life to this body. And so if every day I give myself some time in silence, it can be 5 minutes. We can start with 5 minutes each day. And really try it for a short time. Try it for 1 week. And discover your real self. We call it self-inquiry or self-discovery. And you will come to know that behind this body is beautiful soul that is independent of anything that is happening around me. And this lockdown that is happening to the whole world is actually forcing people to sit at home and look inside. Because this is the time of awakening. This is the time when we wake up and come to see the real self, the real diamond within. It is peace, shanti. It's like there is an invisible traveler that comes just for a temporary period to this stage. So imagine your life is like just a story. There's a beginning, there's an end. But you, the real being, is eternally there. We are always here. The soul never dies. And this gives me security and inner peace. That no matter what happens, high drama, low drama, everything is subject to change. Everything comes and goes, even the severe sicknesses, even the challenges, they all come and go. But I, the real being, am always at peace. Thank you very much. Thanks, everyone. Happy to be with all of you. Om Shanti.
Thank you. Thank you, Mona, for taking us on this spiritual journey from body to the soul. And, that's why every faith believes that dust to dust. So the body will be going to the dust, but what will remain is the consciousness, the mind, the soul. So now I would like to, one question maybe, I mean, I don't know, we don't have time. It's not almost, it's 12 o'clock in India. And our two doctors are still so patiently sitting with us till now. And yes, somebody raised hand. Darshana, please. You can ask your question, or you can write your question. I think that will be better. And you please write your question, and then I will share one information with all of you for our future program. Please watch this video. You are this photograph, this flyer for the 11 December program. Please, all of you can join this. Miss Mona will also be there, and we have chief guest, Ambassador of India to Kuwait, and Dr. Ali, and Dr. VP Gangadharam, and special message from Dr. Harshvardhan, Honorable Union Minister for Health and Family Welfare in India. So I hope you can join this. It will be at 5:30. So maybe you can take a photograph of this and just mark in your calendar. So anybody has written the question? Yeah, there is one. How do you manage cases of BRCA gene mutation? Somebody has asked this question. Sarah has asked Dr. Chitradhara.
We are asking a prophylactic mastectomy and oophorectomy for the BRCA mutations.
Okay, so with these kind of questions, I think will be very, only for professionals. They will be able to understand these.
No, prophylactic preventive mastectomy, just like Angelina Jolie preventive mastectomy and reconstruction, okay. And the removal both ovaries.
Okay, Darshana ji, please ask your question. Maybe, let me unmute you. I think you're not able to. Mona, you have anything to ask?
No, I think there has been a beautiful depth expansion.
Yes. Once again, everybody will be muted for a second. You can unmute, huh? Yes, Darshana ji, you can unmute yourself now.
Yeah, thank you very much. Thank you very much for giving us lots of information about the cancer that we don't know. My question is about my brother, and he's in Canada, and he's suffering from the bile duct cancer that's in Y junction, and they put stunt, and they are giving them they cannot give the chemo. They try to do the surgery, but that cancer is around the liver also, and it's too much spread, and they because of that infection is coming again and again, so they cannot able to do chemo. Chemo is not possible because of the infection in the stunt. So what else can be done apart from the chemo so that he can be cured or do, because of the pandemic, he cannot move anywhere else for the treatment. Is anybody can help me in this?
Shall I answer? Yeah. For the first line of treatment for gallbladder cancer is surgery only. And also, if that is
they removed the gallbladder. They did the surgery, try to remove the cancer from the bile duct, but the cancer was too much spread, so they removed the bile duct.
So then the adjuvant treatment, usually we give chemotherapy as an adjuvant treatment. That means in addition to the main treatment, for further control of the tumor, adjuvant chemotherapy, additional chemotherapy is the usual practice. But in this particular situation, you are telling that your brother is not in a position to accept or receive the
Yeah, they cannot able to give the chemo, and because of the infection is coming again and again in the stunt.
thing is that we have to control the infection, and once the infection is controlled, and if his general condition is satisfactory, he can be taken up for chemotherapy. There are good chemotherapeutic protocols
Yeah,
which can control or which can
but the problem, sir, is that the infection is not going at all.
that may
It's
be
continuous infection. Like every time, every 3 weeks, they are changing the stunt, and again the infection comes. The fever goes too much high. He's in the hospital from last 6 months, and we were too much tense what to do.
yes, yeah.
And we are in Kuwait, and he's in that we cannot help it. But he's my brother, so you can understand the feeling we are having right now.
Yeah, it's in that situation, yeah, maybe very difficult to give any specific treatment for carcinoma of the gallbladder. We have to give only supportive care and wait for the proper control of the infection. Then later he can be reassessed and
Is
rescheduling.
anything that anything? Yeah, sorry. It's anything needs to be done to control the infection, because it's coming again and again, again and again.
Is
The
he
immunity is
diabetic?
too much low that
Is he
he's not
diabetic?
able to recover.
Diabetic? Is he diabetic? Is he?
Yes, he is diabetic.
Yeah, that may be another reason for his recurrent infection. And the stent is also inside. And what about his age? How old is he now?
He is 52 years of age,
Yeah, so various
and
factors.
his living is like he's non-alcoholic. He never uh, drinking, no smoking, and he walks daily. He do yoga. He wake up at 5 o'clock and do yoga, go to walk. His lifestyle is too good that we are inspired from him. Now we are totally shocked to heard this news from like
Yeah,
my
but then
sister, like it's
the
happening.
options in front of us is the proper, good, active supportive care to contain his infection. And also his stent may be creating some issue for him, and his diabetes, the age, everything may be the contributory factor for the recurrent infection. Then once the infection is under control after re-evaluation, he can be considered for other specific treatment. If that is not possible, then we have to focus on the symptomatic treatment, treat the symptom and give good supportive care.
Can we, sir, recommend your number to my brother, because
Please,
my sister, like sister-in-law, shall I give your number to him so that she
no,
can also do required something? Like, is
no
it
issue.
possible that we can contact you further?
Yeah, sure. No issues. No
Yeah,
issues.
thank you. Yeah, because we are suffering too much. He is in Canada, and nobody like they are. The government is doing their thing. Like we cannot do anything, and he cannot come to India right now because he, first of all, his health is not allowing to fly too much distant place.
Let
Second
him talk
thing,
to me.
right now the pandemic is also going on.
Yeah, let him talk to me. Let me listen to
Yeah.
him and let us see what we can do for him.
Yes, thank you very much. This is a big help. It can be done if you will a little bit. Your support would be required. So I'm literally thankful whatever the advice you are giving me right now. Thanks a lot.
Thank you.
Thank
Thank
you very
you.
much for conducting such a session. We are really grateful to you.
I got a question. That is, what
Yes.
age is ideal for starting meditation? What
Mona
about
ji,
young
you want to
children?
answer?
Yeah, you
What
can.
age?
Yes,
Yeah.
yes.
I think nowadays we should start in a very small age. But I think it depends on the Atma, you know. Sometimes children are small, but their soul is old. So they grasp. And I think children nowadays are very clever. And that we have special actually meditation CDs in English for children as well.
Do you recommend any book for that, as a guide or something like that, for young children to initiate meditation?
I think we can find out. It doesn't, it's not in my head now, but I know when we eat.
Videos or something like that? Or,
Sure, sure, yes.
okay, thank you.
Sometimes they are also in the form of stories for the children, you know, so they can visualize and they can, you know, their own way, you know, it's like done in a way where children feel excited to hear the end of the story, right? Pavitra, I think, was doing some also programs.
Yeah, we were having children sessions, and I actually remember that I used to enjoy children sessions the most because they were more focused, more serious, and really, and
Yeah,
the
and
secret was I was learning from them. So that was a very beautiful. Really, I still remember and miss those days. I hope they will come soon.
Do you
And
have
I
any
would suggest.
online programs for children?
yeah.
We can do, of course, yes, it's a good idea. We can start now because we recently shifted to some other place. I mean, in Kuwait only. So we'll soon be starting and we'll let you know for sure.
Pavitra, I think Mimi started, my daughter,
Acha,
but she's doing it in the Arabic language. But
acha, acha.
maybe it's a good start to have it in English as well.
Yeah, for
But
children,
I
it's
think
so
children
important.
nowadays they have like their mind is absorbing all the time. So it's
Right.
good if we can divert them from the PlayStation and the other games a little bit.
Right.
Yeah,
Yeah. You're right.
yeah.
Mm.
Also, one last important thing here. We have in audience Dr. Renu Gupta, and she
Right.
is actually a very, very special soul. And actually, she wanted to share in today's this session, but because as I said, she's a very special case. I just want to read out to all of you what she shared with me for all of you. She said that I am associated with Harmony House since many years. I'm so grateful to Harmony House for sharing the spiritual knowledge in Raj Yoga meditation, which is helping me a lot to have inner strength during my personal journey of fighting oral cancer at this time. And she's right now, she's in Canada. She wanted to share, as I said, but her video is off and she can't share. I just saw her with the mask and all those things. So, but she really, really very special and very powerful soul, I would say. Right, Mona?
Yes, actually, she has maybe this is her
She's there.
13th,
She's here. She's here. She's here.
this is maybe her 13th
She's here.
operation,
Yeah.
and every year she would go to Canada once or twice to complete her surgeries. It's in the mouth. But really, I have seen her as an example. You know, we speak about people to have power to fight the cancer, but she has actually demonstrated actually, and because you never see her sad or complaining, she's always happy and cheerful and
Yeah.
really a real example. Thank you,
Yeah.
Rina.
No doubt.
She's actually a radiation doctor.
Yeah.
She's a doctor
She
at the
herself is the doctor. Yeah. And
and
very powerful doctor.
she works at the hospital as well, Mubarak Hospital, which is one of the biggest governmental hospitals. She's a teacher at the university. And I don't know how she manages her time, but she comes to our classes and she takes benefit whenever
Even from
she's.
Canada, she has come, right? See?
Yeah.
See the salute.
She radiates not only the patient, she radiates love, affection,
Yes,
confidence.
yes,
Yeah.
yes. Really, it's true. It's true.
Pass our love to her, please.
Yes.
Renoji, we miss you here. Come soon.
Yeah, Renuji, आओ जल्दी.
And a warm invitation for Dr. Mohan and Dr. Chitra Tara. You're most welcome to visit us here in Kuwait when the
Yes.
pandemic.
Yeah,
We'd love to have you here also.
yeah,
Kuwait and India is, you know, they have a friendship, Kuwait and India.
yeah.
So we have a strong relationship.
Yes.
What shukriya or
Yeah.
namaste?
I just want to say again thank you to Dr. C.N. Mohanan Nair ji, Dr. K. Chitradhara ji, Dr. Surendra Nair ji, and Mona ji, Mona Larfaj, Vibhish ji, Rupesh ji, Nisha ji, and all the hidden soldiers behind this program. So
Thank you
many.
for facilitating.
Yes, yes, yes. See, we have yeah, Vinod Bhai and Chitra ji. They are from which? कहाँ से हो आप लोग अभी? You are in India or where? You are muted. You are muted.
I'm
Mumbai.
अच्छा,
We are from
Mumbai. Good, good, good. They're Mumbai because they
So
were in
nice that,
Can I
Pan-
10 second?
Mona
10
sis-
second?
Yes,
10
yes,
second?
please.
Yeah, I would like to express my heartfelt thanks to all of you for giving me a chance to share my limited knowledge in oncology with you. And also, I would like to extend my thanks to Mr. Vibhesh and also Miss Nisha,
Yeah.
who worked very hard in coordinating all these activities. And also, they called me several times, communicated with me. So, kindly convey my thanks and regards to all of them. Thank you.
Thank you. Thanks a lot. Thank you, Dr. Chitradhara. And you're so peaceful and patient. And thank you. Doctors have to be patient, right?
They need a lot of patience.
Yeah.
Thank you so much, Pautraji, Munaji,
Thank you.
Vibhish.
Hopefully, hopefully
left
see you all either in Kuwait or in Kerala.
Okay.
Yeah, it's best
I
to
hope
go to
near
Kerala.
future, yeah.
Thank you. So
Or we can see like this online.
yes, yes, at least this is the way these days. Thank you. It's already 12:15 there.
Okay.
Thank you. Thank you.
Good night. Good
Good
night.
night.
Bye.
Godly
Good night.
night. Good night.
Night.
Good night.